also what is cervical cancer, and why focus on prevention and also early detection by the bevolkingsonderzoek, why it is important. And also short information about women's health in the last couple of years in the Netherlands, how it has improved, but there's still work to do. And also why this presentation I think is important, to increase the awareness about cervical cancer and also the importance of the bevolkingsonderzoek, and encourage also informed participation so that everyone goes to the call when you get it. First of all, what is cervical cancer? Cervical cancer is the cancer of the cervix. And then I think maybe you can ask, well, what is my cervix? Uterus is the lower part of the uterus. And it's a small piece of the organ, maybe 4 centimeters long, but it's a very important part of our uterus. It has a function of a barrier to protect the inside of our uterus from the outside world. It also helps us women to know if our cycle is regular. If you get your period every month, you know that there is a passage through working. It is also a very important function in our fertility, to get pregnant. But then when you get pregnant, it has an important function to stay pregnant, and then after 40 weeks to deliver that baby safely. So it's a very vital part of our reproduction system. And unfortunately, this vital part is also can fall victim to dangerous cells. So what happens in cervical cancer? The bottom picture, you see the uterus as it is in our bodies, and then the lower line is the aspect of the cervix. So you see, I have difficulty with link, but yes, that part that's left, yes. The left one is a normal looking cervix, and then the other, almost to the right, is cervical cancer. So the aspect changes, and you can see that with your eye when you go to the doctor and they examine you. It's very visible to see. What can be the symptoms of cervical cancer? It can have many different symptoms, but some are very alarming to us and should be also to you as a woman. One of the most important signs can be bleeding in between your periods or after intimacy. It's too sensitive, irritated or inflamed, or maybe with bad cells, that it starts bleeding at random. But also it can be pain, that you feel a constant menstrual pain when you know you don't have your period, or maybe already in your menopause, but then you start to feel some pains that you say, I remember this from then, why is it happening to me? That can also be a sign. Difficulty or pain with urination, because if a mass is growing next to your bladder, it can also hinder urination. But sometimes it can cause different symptoms like a swelling of one leg, pain in one leg, or sudden weight loss. So those symptoms when you're starting to lose weight, when you don't have the intention to lose weight, or you're not trying so hard to lose all that weight, should also always be an alarming symptom. What is cervical cancer? Well, cervical cancer can happen, most of the time happens because of an infection with the HPV virus. But it's not the same when you just have an HPV infection. So there's a difference between an HPV infection, abnormal cells, and in the end, cervical cancer. It's kind of a gradation that can happen over years when you get infected with HPV. That can last a couple of years. Most of the times, our body clean it up themselves, so you never notice. But in some cases, we don't know why. The body does not recognize the virus, and it lays dormant for years and years and years, and then it can cause abnormal cells. But if those abnormal cells don't cause any symptoms, that can also continue to develop into cervical cancer in the end. So cervical cancer usually develops slowly, but it is preventable. The role of the HPV virus, because that's also a main topic of the bevolkingsonderzoek. The HPV virus is a commonly sexually transmitted disease, and I think almost 90% of people who are sexually active have the virus. And most of the time it is very innocent. It can cause genital warts, so kind of like growths around the genital area. But like I said, most of the time your body clears it up itself and you never know that you've had it before. But some of the HPV viruses, because there are maybe like 100 types of viruses, are dangerous. They can develop into the cervical cancer. And those viruses are HPV 16 and 18. Those are the high-risk viruses. So like I said, HPV is very common. Most, like 90% of the people have it, but cervical cancer is very rare, and therefore the screening on the HPV 16 and 18, the most dangerous types, really matters. In the Netherlands, almost 900 women get diagnosed with cervical cancer every year. And the peak age is between 35 and 45 years. So that's quite young for such a disease. And even though we have made a lot of progress, still 200 women every year die because of cervical cancer, and they are mostly younger than 60. So there's a lot of progress to be made to protect our women, our young women, from this nasty disease. And in those cases, it's always the HPV 16 or 18. And we've noticed that there is also a prevalence per ethnicity. Before it was thought that it's mostly the white women who would get it. It's racial type of women. So it is increasing in the Surinamese women, in West African women, but also in North African women. So that is a lot of progress that we still need to be made, because we see that those women come at a much later age than the white women. We don't know for sure what the cause is, but I think that we can still book a lot of profit in the early detection through the screening from the bevolkingsonderzoek. The next slide, please. So what is the bevolkingsonderzoek? It's national organized screening program. So basically every woman in the Netherlands from the age of 30 gets the invitation by letter. Sometimes when you're 29, almost 30, you already get the government saying you're almost 30, you should come and check yourself. And before it was that you had to go to the GP office to get it checked, but now they made the barrier much lower by sending you also a kit to check it at home. Can you do the next slide? So nowadays it looks like a self-test. I think we can remember the COVID times where you have to do the swabs. It's exactly the same, only for the cervix. So you can do it in the privacy and comfort of your home, that you check yourself. You insert the small cotton swab inside and you just take some discharge. You don't have to do anything too difficult with it. And then you put it back in the tube, you send it with the envelope back to the bevolkingsonderzoek, and within, yes, thank you. And within 2 weeks you get your results. And this home kit tests for the HPV virus, the dangerous two, so 16 and 18. If you don't have the virus, then you're so low risk that in 5 years you get an invitation again. If you do have the virus, that means HPV positive, you get an invitation to go to the GP for the old-fashioned exam with the ene bag in the chair. And then they take a swab to look at the cells besides the HPV. This is a bit complicated scheme, but it kind of shows you what can happen through the whole process. So like I said, if you don't have the HPV, you get your invitation 5 years afterwards. If you do have the HPV, you go to the GP, they take the old-fashioned pap smear again, a little uncomfortable, but it is really necessary. And that the advantage of that pap smear is as well, like I showed you before, you can already visually see abnormalities on the cervix with your naked eye. The pap smear takes about 2 weeks for it to be the results to be in, and depending on the results, you either get kind of expectant management, that you do the test again every 6 months, or you get sent to the hospital like the AMC where they do an additional test. And sometimes when they do see abnormal cells, but it's not cancer, luckily, they can kind of shave a couple of millimeters from the cervix, kind of like a cheese grater, just a small layer, take it off. They test it again, and then everything is clear, then you get back in the cycle for every 5 years. The next slide, please. So why to participate? Because with the bevolkingsonderzoek you detect HPV before it can develop into abnormal or cancerous cells. The treatment of abnormal cells, like I said with the cheese grater, is much less invasive and painful than the cancer treatment, obviously. And the screening obviously saves lives. The sooner you detect it, the sooner you can treat it, and the more complications and problems you can prevent. So participation in this bevolkingsonderzoek is basically taking control of your own health. Common concerns and misconceptions can be, I have no symptoms, so I don't need to check myself. If everything is normal, why should I check myself? Like I said before, HPV most of the time does not give any symptoms, so that's why you need to check yourself. It's uncomfortable or embarrassing. As a woman, we know the feeling of going to the GP for that kind of exam. You better not do it, but that is really not necessary anymore with the home kit. You can just do it in the comfort, the privacy of your own bathroom, examine yourself. If it's necessary or you find it too difficult, go to your GP or the gynecologist. We do it every day, that's our core business, so there's nothing embarrassing about coming to the gynecologist. Or sometimes the idea can be, I'm older, I'm already in my menopause, so I'm not at risk. Unfortunately, that doesn't really matter. If you have a cervix, you're at risk. So if you're a woman, you're at risk. Luckily, the last couple of decades, we've also made progress in also the preventing of HPV. So not only the early detection, but also the prevention. And that is by vaccinating our youths. So children, boys and girls, between the ages of 10 to 18, generally the idea is before they become sexually active, you can vaccinate them against the HPV virus, and it's a combination vaccine, including the types that can cause cancer, so as in girls as in boys. And the idea is if they get 2 shots with 6 months in between, they are immune to those cancerous types of HPV, and therefore we will hope to see in a couple of decades to really see a decrease because our youths are already vaccinated. But that doesn't mean that screening is not necessary anymore, so especially if you have symptoms. So the combined approach is the best approach, but it's not the golden rule, so you still need to be aware of it. Barriers to participation and how to overcome them, like I said, fear and discomfort, fear of the unknowing, fear of being in a situation that you're not feeling comfortable about, that is known. Do talk to your GP or your healthcare about it, because we will take our time to make you comfortable during those exams, because your health is most important. Sometimes it can be lack of time. I'm too busy, I don't have time to take the appointment, to go to the MC, to wait 40 minutes in the waiting room because they're always late. That's the easy part of the self-test. You just go to bevolkingsonderzoek, you request the self-test kit, it comes through the mail, you do it when you want to do it, you send it on the post, and that's it. Sometimes it can be a language barrier because before everything was in Dutch, so you don't really can read or understand much about it. Luckily, we've also made progress by doing it in more languages, but there's still progress to be made from our side with that. But also cultural taboos. I'm Surinamese and I have to tell my mom, beg her to really open that mail, to really do that test. It's not embarrassing, it's helpful for your health. So we really need to talk to each other about it, to our sisters about it, to our daughters about it. That is not a taboo, because your body is the only thing you really have and you need to take care of it. It's not a taboo. And the self-sampling, I really believe lowers all those barriers. Read the letter carefully. If something is not clear, call someone to help them explain to you. With the letter you can also make a choice. Some people really prefer to go to the GP, other people don't prefer to go to the GP, so that's also in your control. Do what is comfortable or the best approach for you. Don't postpone it, put it in your calendar, make sure you don't forget it. And if you want more information, because information is key, you can always go to the RIVM. They explain it more. There's also a website called baarmoederhalskanker.nl. That's also for the youth. They're also even on TikTok, so it's for everyone, appropriate, and obviously to your GP. So I think the next slide. The key message is cervical cancer is largely preventable. So if we do the screening, we can really help save a lot of women. HPV is common, but luckily not as dangerous as we think, but therefore screening really is essential. And the bevolkingsonderzoek is free, it's reliable, it's not painful now with the new self-test, and it is life-saving. So participation really protects you and our future generations. That's it, thank you. Do you have any questions now about this part?